Hi friends, let's talk about PGD in this video. PGD stands for Pre-Implantation Genetic Diagnosis. This is an advanced technique which is done along with IVF to prevent passage of genetic disorder to the future baby, or it can be used for HLA typing also. In case you have a previous baby with genetic disorder, you need stem cells to treat that baby, you can do this technique. And there are various disorders which can be treated. More than 600 known genetic conditions can be cured with this disease. The most common ones are cystic fibrosis, sickle cell anemia, thalassemia, spinal muscular dystrophy, retinoblastoma, and there are many other disorders. With this technique, you can prevent your future baby from having this disorder. So in order to do this technique, the first step is to do a blood test. You have to do DNA profiling of both husband as well as wife, sometimes even the grandparents also. With this profiling, we will be able to see what is the genetic mutation, which genetic mutation do you carry, and whether there is what is the chance of carrying this genetic disorder to the future baby, whether it is 50%, 75%, 100% or 25%. Once we know all these details, the next step is to go for PGD. In order to do this PGD, we need embryos. So how to create embryos? In order to create embryos, you have to go for IVF. Not IVF, ICSI method, where we inject single sperm into the egg. So from second day or third day of periods, you have to take injections for 8 to 10 days. Once injections are completed, we will follow up with egg pickup. We will collect all the eggs via scan. We will screen the eggs, clean the eggs. With each individual egg, one sperm will be injected. And after 1 day, there will be a fertilization check. Embryo will be checked. This embryo will be grown for further 5 days. So on day 5 or 6, once the embryo reaches blastocyst stage, we will remove 2 or 3 cells from the embryo and the embryo will be frozen. This particular cells will be tested for genetic diseases. And if the cell is positive for genetic diseases, those embryo will not be transferred. And if the cells are normal, which means the embryo is normal, those normal embryo will be transferred into the uterus. With this technique, there is 99% chance of eradicating this known genetic diseases. Even during pregnancy, you have chance of screening the baby if there is any genetic disease, so that you can confirm the diagnosis. This PGD technique is relatively new. In UK last year, there were only 700 cycles performed. So that is the reason, even in spite of doing PGD, we have to go for further genetic screening even in pregnancy. And the total duration for this particular technique is nearly 2 months. So in the first month, we will be creating embryo and freezing the embryo and subjecting the embryo to genetic testing. In the second month, we will be transferring the embryo. In some unknown genetic diseases, this procedure may take longer time, like 3 months or 4 months. But you need not come to the clinic for the entire duration. The first step, you have to come to our clinic for 15 days and go back to your country. Once the report is ready, we will inform by email or WhatsApp or whatever method possible. Then you can come here for 1 week for embryo transfer, and you can immediately fly after embryo transfer. Thank you.